Have you heard about the new gel that's turning dental science on its head? It's pretty revolutionary in how it repairs tooth enamel.
Absolutely. So this gel, it actually regenerates enamel? That sounds like a real breakthrough for dental health, right?
Yep, exactly. It's a protein-based substance that mimics the very features we see in enamel developing in infants, acting as a scaffold for calcium and phosphate
Yeah,
ions.
got it. Interesting. So essentially, it provides a framework for the enamel to rebuild itself, unlike traditional treatments which merely manage symptoms.
Right, exactly. Now, you see, traditionally, enamel decay is a major headache because the enamel just doesn't regenerate naturally. This gel might change that entirely.
Absolutely. With around 3.7 billion people facing oral diseases globally, this certainly sounds like it could have a massive impact. But how quickly can it work?
Well, the studies actually show that when applied, you can witness significant enamel repair within, say, 2 weeks. The electron microscopy images clearly show the difference between demineralized enamel and treated enamel.
Right, that's pretty impressive. And the research isn't just from one lab. It's a collaboration with experts worldwide from the University of Nottingham School of Pharmacy and Chemical Engineering, isn't it?
Exactly, and that collaboration really adds weight to the findings. It's like a convergence of expertise with each team bringing something unique to the table.
Yes, indeed. Now, what's really compelling is that this gel is being designed with both clinicians and patients in mind. It sounds so user friendly, but isn't it a bit early to see it in action in everyday dental clinics?
Well, the lead on the study, Professor Alvaro Mata, mentioned the gel is easily and rapidly applied, and they're aiming for a product launch next year. Though I do wonder if the transition from lab to clinic might face unforeseen hurdles.
That's a fair point. Right. I mean, innovation in the lab can sometimes run into practical challenges in widespread use. So, while the promise is there, caution might still be necessary.
Exactly, and there's an interesting critique from Professor Paul Hatton, who's been calling the regeneration of natural enamel something of a holy grail in dental materials science. He sees this as well an exciting breakthrough, but also implies that more research is needed for it to become the new standard.
Yeah, that's a good challenge to consider. It makes sense. Plus, if it really turns out to be as effective as initial studies suggest, we might be looking at improved methods to prevent issues like infections or even the cascade of conditions connected to tooth loss.
Absolutely. And considering that enamel decay is linked with increased sensitivity and even more serious conditions like diabetes and cardiovascular disease, the broader health impact could be
Truly
transformative.
transformative. With such a potentially enormous impact on oral health worldwide, it almost feels like we're witnessing science catching up with a long standing need, doesn't it?
Exactly. And it's like, picture it as a tiny repair crew working meticulously on your teeth. It's like having a natural mini construction team that builds back your protective enamel shield.
Absolutely, that analogy fits perfectly. But I'm curious, do you think it could replace current methods like fluoride varnishes, or will it serve as an adjunct therapy?
I think initially it might be an adjunct, especially since fluoride treatments have their place. But if the gel proves reliable, it could, eventually revolutionize the whole approach to dental care.
Yeah, that's an interesting possibility. It's truly exciting to see such advancements. I guess now we just have to wait and see how this technology evolves and integrates into everyday dental practice.
Exactly. With a possible product release next year, it's an innovation many of us in the field and patients alike are really looking
Absolutely.
forward
Here's
to.
to future breakthroughs.